have couples, they're actually in bed together on their tech devices, yet they're coming to sex therapy because they feel they don't have time or energy for sex. I'm Dr. Sandra Lindholm. I'm a certified sex therapist and psychologist in the Bay Area. In terms of the age ranges, with my patients, I see people all the way from age 18 to 85. However, more recently, I am seeing more younger males coming in with a variety of male sexual functioning challenges and issues. The kinds of issues I'm commonly seeing in these men are issues related to sexual desire, specifically low desire, meeting women, also issues that the public might relate to as performance issues, so problems with getting erections, arousal issues, ejaculatory issues, etc. A client, let's say for the sake of discussion, we'll call him Mark, and he worked for one of the big tech companies, and he presented to me with issues regarding getting and maintaining erections, and he was in his late 20s, not an age we would typically think about having issues around erections. Mark's lack of sexual knowledge and experience created a good amount of anxiety for him. So when he reached a point in the relationship where they were becoming sexual intimate, he was really almost petrified, and he couldn't keep his erection. If he did get one, he would lose it soon after. He felt like he didn't have confidence in how to please a woman, and a lot of Mark's sexual knowledge was based on internet erotic imagery, aka porn. So what he learned there doesn't translate well in real life sex. So he felt at a loss. So one of the things we worked on in therapy was his relationship to sex. We worked on actually sexual skill building through reading and watching portrayals of more real sex so he could better understand what women need, what they like. We talked about ways to communicate with women, early seduction styles, etc., and really boosted his confidence. I have one particular client, we'll refer to him as Kevin, and he also worked for a Bay Area tech company, and one of the issues he presented with was distractibility during sexual intimacy, which is a big problem if you're trying to maintain erection and erotic pleasure. And when I asked him to describe, exactly what would happen, in the bedroom, one of the things that I discovered is that he had two phones plugged in. He had an iPad plugged in. He had his regular landline phone, etc. And typically he would have all of these devices on while he was trying to be sexual. And so he would get alarms would be going off, rings, etc. So it's really hard for him as well as his partner, because his partner also joined him a couple times in session, was talking about how distractible it was. And beyond that, she really felt ignored to a certain degree, and it was really hard for her to really let go and feel he was present with her when he was actually sometimes stopping sex to attend to, a ringing message from an email, etc. Another suggestion is to not base the early phases of a relationship purely on tech. A common comment I hear from women dating techies is that they have little direct contact via, say, phone, that they're just constantly wanting to text. And it can build a false sense of intimacy, whereby you feel like you know somebody, but you really don't. And the early stages of a relationship, the courtship stage, they're very important in creating the relationship. It's great to use tech to meet people online, but try to get a little more personal earlier in the relationship. Otherwise, you're really just creating a profile of somebody versus just getting to know them.